U.S. Preventative Services Task Force is releasing new proposed recommendations for prostate cancer screenings. The task force says that men from the ages of 55 to 69 should not be routinely screened and should make individualized decisions about screenings with their doctor based on their own risk factors. In addition, the task force is also recommending against screening men age 70 and older. Officials say this is because prostate cancer is often very slow to spread and can be managed in most cases by careful supervision without active treatment that can have life-changing side effects. So these new recommendations are still just a draft and are open for public comment until May 8th. And how about this? The importance of a good night's sleep is well known, but the results of a recent study from the American Cancer Society may provide even further evidence of that fact. New findings reveal men who sleep less than 5 hours a night have more than a 50% higher risk of prostate cancer. Dr. Leonard Gomella from the Sidney Kimmel Cancer Center at Thomas Jefferson University Hospital here to explain. Good morning, sir.
Good morning. So this is a very interesting study that was just released. The American Cancer Society has a very big study of men and women understanding their lifestyles and their health issues. And what they recently discovered was, as you mentioned, that men who sleep less than 3 to 5 hours a night have a 55% higher risk, 59% higher risk of dying from prostate cancer, which is very interesting. And men who slept about 6 hours, that was about 29%. It looks like the tipping point was around 7 hours is sort of the safe zone. So good night's sleep may be preventive for developing prostate cancer.
And tell me why. I mean, just your body needs time to heal. Why is that?
Well, I mean, that's probably part of it, but there's a theory that chemical known as melatonin in your bloodstream, which sort of regulates your sleep and waking cycle. Low levels, if you don't sleep enough, may increase the risk of damage to your cell's DNA. So this is all theoretical right now, but that is a plausible explanation why this may be happening.
Now, the scary part about this for me and for pretty much everybody I know who works in this industry and particularly works mornings, none of us get that much sleep. I don't know a lot of people who get 7 hours of sleep. So is there something you can do? I take melatonin.
Yeah, so that's a great question. The problem that we have right now is there's really been no study that has been proven that actually taking your melatonin from in your mouth into your body is as protective as your own naturally produced melatonin. But again, remember, this is all theory right now. Okay. So right now there's no role for melatonin in actually preventing any kind of cancer, including prostate cancer, but more research certainly needs to be done. So we need to get some more rest.
I also want to go back to the first segment that we were talking about, the screenings. I remember even in my lifetime, it was once you hit 40, mandatory. Then it pushed forward. Now it's not even mandatory at 70? Why?
Well, this is very controversial, and we applaud what the United States Preventative Service Task Force have done, because 4 or 5 years ago they said no man should be screened for prostate cancer. We're very happy now that they backed away from that a little bit and say, okay, men 55 to 69, at least talk to your doctor about it and have a discussion. So we're very happy about that move forward. The recommendations in the draft form are not perfect right now, but they're much better than when 4 or 5 years ago when they said don't screen any man for prostate cancer.
Okay, so we should be encouraged by it.
We should be very encouraged by it.
Doctor, thank you.
Okay, Bill, thank you, Bill.
Appreciate you, sir.
Appreciate it. Thank you.